Yesterday, a young girl died in a school. She died of suicide in a school, 17-year-old. Well, a couple of days ago, or yesterday, a couple and their 2 children were found dead. And the 2 children were probably having disabilities. So things are difficult. 1 out of 7 Indians are mentally ill, ma'am. And India is in the throes of a mental health epidemic. In such a situation, what do you feel are the specific emotional needs that may manifest in an inclusive classroom if the child has any form of disability? We have 30 minutes. Brevity is virtue.
First of all, Dr. Shetty and all my esteemed audience, I would like to say that, the dividing line between feeling mentally unhealthy and being mentally healthy is very, very fine. Many times when we are not able to, do something which we want to do, we feel very frustrated and we feel very anxious and, all that. So I'm going to talk here about children because Dr. Shetty is, of course, expert with adult. He'll talk more about them. But in my case, I'm talking about school education. So what happens in a class, whether the child is with disability or without disability, the problems can occur anywhere. So a lot of things happen with the teachers and nobody comes to know till some time has gone by. So what is important now? The question here was also whether affluent families and the poor family, the data here shows the more the poverty, the more the mental problems. Although affluence also is linked with it because people who have a lot of money do a lot of drug and alcohol abuse. So, but with financial strains and with no support structures and with having, no knowledge about and I'm talking more about India, a lot of stigma attached. So what happens is that whenever you even see some symptoms in a child, you feel that this will be okay after some time and, you don't need to go away. I know in schools and also in houses where the parents would go for family functions like marriages, leaving their disabled child behind. We can't take this child to any function because all people would talk. So what do you think will happen with this child? Mentally, the child will not only get depressed, isolated, rejected, anxious, and also have no social communication. So I think disability is an add-on to mental health problems. Mental health problems can occur in any child, but with disability, there is a bit of discrimination, there is a bit of prolonged social deprivation, which leads them to be even more anxious and depressed unless and until they get proper warmth, respect, and attention from their teachers. Thank you.
I think fantastic. What she says is acceptance is the most difficult challenge. And what I've been always saying across time is there are 4 emotional needs of children. One is physical safety and emotional safety. Kuch bhi hua to theek thak karenge. We will correct the child but not throw the child away. Come what may. Though the school might have a difficult name, other parents might object, and that is something they negotiate. The next is respect, and third is trust, and fourth is love. Thank you for that beautiful answer. Lisa, thanks for coming all the way. And I'm sure you must have had the vada pav and the golgappa in Bombay. No, they have not given you. They're giving you pasta and... I wish somebody asks her to go to the beach and have golgappa as well as vada pav. Lisa Mauro-Bracken has a master's in public health, and that's so beautiful. Population and family health, and she's from the Columbia University, New York. Baba Saheb Ambedkar was there, and he did his master's and his bachelor's in this university with Jim Dovey, who was the member of the American Psychological Association. And he had a tremendous influence. He was influenced by Jim Dovey and the work at Columbia. He, learning and teaching higher education, fellow in Higher Education Academy, is currently the head of Department of Health and Wellbeing and a principal lecturer in Health and Social Care at the University of Worcester, away from London, but London has not influenced Worcester. That's what you said. Yeah, beautiful. Prior to being in the university, she worked in asylum seekers and refugees in Ireland, so marginalized population which have been excluded, and a lot of international global health works providing support to women in various Pacific Island nations. So for you, ma'am, do you think emotional problems or depression is more to do with economically affluent section of society only? One out of eight people on the earth are mentally ill. And India, for your information, my dear friends, the suicide death ratio in India among women is twice that of the world. Twice that of the world. It's something which we need to understand. The third data point is under 18 in India, girls end their life by suicide more than the boys. Whereas in the other age group, it's always also the men. Yes, ma'am.
Okay, so I'm gonna take you back a little bit, because if I think about mental health within our student population, over the last 5 years, it has increased threefold. So 1 in 6 university students have mental health issues. Some of those are disclosed at application, and some of those are disclosed after they've been studying and they're starting assessment. So the increase in mental health within the UK has... You can hear me. Can you hear me now?
Yes.
Okay. So the increase partially is due to COVID. So our 18, 19, and 20-year-olds joining the university were the ones who were isolated, didn't study the same way, didn't have exams the same way, and they're now struggling at university. The other part of it is within the UK at the moment, there's a cost of living crisis. So the number of people going into poverty has actually increased, and it's really making it difficult for students to study. There are some support services available, but a lot of students don't access them. If they're in mental health crisis, actually filling in forms is really difficult. So the poverty levels within the university and the students who come from impoverished levels is probably higher than some of the other schools in the area. Within my department, we run what we call widening access and participation programs. Many of our students did not complete their secondary school. They come to us without any formal qualifications. They have been working for 3 to 10 years, and they join us through a non-traditional route. And many of those, if I'm thinking about some of the conversations we've had over the 2 days, in terms of acceptance. I can share a case.
Yeah.
A student joined us having, and I'll go back to your topic, which was suicide, having lost a friend through suicide. She came from what we call a least likely to attend university area around Birmingham. She had a hearing disability, which also impacted the way she spoke. This student was interested in becoming a nurse. However, she was told throughout her time studying that she would really not be able to attain that goal because she couldn't hear properly. She was made to feel less than. The programs that we run focus on that confidence building in the first year. So we spend a lot of time trying to alleviate some of those emotional needs and mental health issues to develop their capacity to actually study. This student is now working in Ormond Street Hospital, Children's Hospital, as a nurse. And she's planning to study public health.
Volume badao taliyon ka.
So, and we have student upon student upon student that is like that. They come to us, they often have undiagnosed mental health issues and undiagnosed learning disabilities, which led to them being called inappropriate names by their teachers. And so it's that confidence building that gets them through.
Beautiful. It's a lifelong process. It takes a long time. It's intangible and it really works. But one thing about India, 1 out of 4 people who end their lives by suicide are daily wage laborers. And 1 out of 3 people who end their life by suicide is because of family problems. So go back and hug your wife, hug your husband, hug your mother so that you are safe. Anita ji, it's a very sad thing that the CBSE board in the statistics showed in 2024 2,23,000, uh, uh, 23 lakh, 22 lakhs, 38,827 people appeared. And the identification of disability, learning disability and autism, because they have clubbed it together, is 0.3%. We are 77 years from independence, and we are still far away in identifying disability. It's a very sad thing when I look at these figures. And also, what is important is government says violence and poverty causes school dropout. This year, the school dropouts have been big. School intake has been, there's a gap between the boys among the girls in lakhs. This is something which is very, very. When we have time, you can help us understand. But with transgender children now being a part of our schools, what special emotional challenges need to be addressed by teachers? Transgender children now being part of our schools, what special emotional challenges need to be addressed by teachers?
So first, your question regarding the CBSE schools. Can you hear me?
Yeah.
So I will give you an example. I will not give you a proper answer because I don't have any research data on that. But I do know that many children with disability are still not.
This is from the website of CBSE.
Okay. So many children are still not going to school. Children with disability. And an example I'll give you is when I visited, some homes of some children who were not sending. The parents were not sending their disabled children to school. And I asked them that when the school is taking that, many special schools also get some money per child, so they want to take the children to school and then later they put them in regular schools. And they said, no, we don't want to send our children to schools. First of all, they will be teased there, they'll be bullied there. And then, we have, this was their attitude. We have cows, we have buffaloes, we have goats. This child can also survive in the house. So this was the answer. So basically, the children who are not going to school or dropping out of school, many of them, majority of them may be children with disabilities.
The point I want to make is, ma'am, not that. 22 lakhs 38,827 appeared in the 10th in 2024. And only 0.3% were identified as disability and autism.
So they either drop out of the schools and they are not studying.
Huh? These are the ones who appeared for 10th, ma'am. Huh? These are the ones who appeared for 10th.
So only 0.3 were disabled.
0.3 as learning disability and autism, Milke. Now, with this new government, they've clubbed autism and learning disability together. So 0.3%, we are missing 8%.
Yes.
And I tell all these girls and boys who are here, dig. Dig as much as you can, because unless you dig, you will not identify all children, and you are destroying the child's future. He gets depressed or gets into a very difficult behavior. But still, ma'am, they are asking you the different question. What with transgender children now being part of our schools, what special emotional challenge? Yeah.
So this is the new education policy when transgender children are a part of an inclusive school. And this is a great challenge. It was a challenge for NCERT also. They did a module on transgender for the teachers. And there was a huge issue regarding the toilets they will use. Yes, but they said that they will not use the men toilet or the women toilet. There was a lot of debate and this module was banned. So we need a lot of awareness regarding this. There's a huge discrimination they will face. There will be a lot of teasing, bullying, which they have to control. So I think the teachers need to be very sensitive and have to sensitize the other children also in the classroom that they are like us. And then if they are getting an opportunity to earn and be economically independent, they should not be deprived of that. The problem is people are very confused about the whole concept. I think it's very new and that I think it will be sink in gradually, but by creating awareness, sensitizing, and also training.
Thank you, ma'am. Lisa, you have more acceptance of LGBTQ in UK, and we see a lot of activism there. So for you, with transgender children now being a part of our schools, what special emotional challenges need to be addressed by teachers?
So if I think about it from the perspective of university students.
Let me get closer, ma'am.
Okay.
Chocobar ice cream.
Yeah, okay. if I think about it from university students, in particular Worcester, we have quite a strong LGBTQ plus network at the university. We had a transgender student 8 years join us. I met the student, and the student was a male student and applied as a male student. And then when she started, she joined us a week before induction and said, "This is who I will be." So that year was a learning experience for all of us. It was something that hadn't been discussed at the university at that point. Since that time, we have professional development programs for all of the university lecturers. The challenges we faced that year were really about creating awareness for ourselves, creating awareness for the other
What is
students.
that one teacher you converted her to be more sensitive to transgender, and she would have had myths about teaching transgender? Can you come to that?
If there were any.
Common myths when teachers meet transgender students. What are the narratives that run, or automatic thoughts that run?
Yeah, the biggest comment is their worry about language. What words do I use? Will I be offensive? So I work in a department where we have been inclusive for quite a long time. Sean introduced us to Universal Design for Learning, and my staff latched onto it because we were already anticipating the needs of our students. And those,
Volume बढ़ाओ यार, क्या करते हो?
I don't need to have a hand clap. It's okay.
It's for you.
Thank you. Oh. He definitely doesn't need one. You know, the inclusive nature of the staff is around their passion for our students. We already know the various barriers they have faced to get into university, some of which are mental health. And before it was the norm to talk about mental health issues, we were discussing it in meetings. So we would have share and inspire learning and development meetings, and we would talk about the mental health problems our students were talking about. And staff from other departments and other parts of the university were really surprised it hadn't become part of the discussion points. Now, it is part of every session you have. Students are struggling. Students have a lot of mental health issues. The support services are there, but they can't manage it because I think it's 40% of our students will declare some type of neurodiversity upon application. 0.2 will declare on application mental health issues, because there's still that stigma, even though we discuss it and it's open, and it's much more open in the UK, there's still that fear that if I say I have a mental health condition, that I will be penalized. But yet, once they start and they meet with their personal academic tutors, those discussions start, and we can refer them. But again, it's quite a large population of the students now who need that support.
Thank
It's
you. I
hard for
think
them
what
to
she says,
access
it takes a long time to get the myths
But with
disintegrated.
transgender, I think in the UK we are probably maybe 5, 6, 7 years on that journey
Very nice.
in terms of being open, discussing it. And it's very challenging because it does bring up cultural issues. It does bring up religious issues. The students themselves often have mental health issues that they're trying to manage because of the bullying they may have faced earlier in life,
Thank you,
because they're not being accepted by their families. So it's a journey that
You need to travel.
it's about awareness raising to begin with, and then about supporting people to understand and to be respectful.
There's no end point. You need to go through it. So we're surprised that stigma exists in Western countries also. But in some sections of our schools, there's no stigma because the students want to go to the counseling center to have a good time. And they love the counselors much more than the teachers. That's how it, everybody, all boys like them. Yeah. This is just on the lighter side. Anita ji, 77 years of independence, and we don't have enough tests for learning disability. In fact, minority students, Muslims, there are lakhs of students in Maharashtra and crores of students across the country, and we don't have tests. I think that's a big fallacy. CBSE tried. Government of India, Ministry of Education inaugurated a center where the lady was appointed to get that. But those tests are also meant for teachers. We have a big gap. And what is it? Is it because we are not bright? Is it because we don't come together and get our act in order? Or what is this? I mean, our children can't wait for hundreds of years.
Let me tell you one thing. I'm a psychologist on one hand and an educationist on the other hand. When you talk about tests, let me tell, I just feel that when you test a child and label the child, it's very difficult for teachers to have expectations from that
No,
child.
ma'am, tests have to be there. What are you talking?
No, tests
What are you talking, ma'am?
no. Let me tell you.
You have provisions.
Now we can have an argument on that.
No
I'll
argument,
tell you.
ma'am. You answer my question very specifically.
No, I'll tell you a case about the test then. I'll tell you a girl who was studying in a school, was diagnosed with learning disability and autistic spectrum borderline. And then it was the CBSE school told that the father, who was a driver, that we can't take children like this in our schools. She was turned out of that school. And then our director, Dr. Krishan Kumar, that time, believed that this test are not reliable because the child may have some house problems, something to do with family.
I would like to stop you here very clearly, ma'am. We have Disability Act years ago, and they said within 2 years all the states should come on ground and do it, though we had COVID. Ma'am, we need tests to test Indian children. DTLD and Nieman's battery is not enough.
So 70...
And rat and woodcock is not Indian.
So you don't mind my
Indian,
argument when I say...
I would want to know as an expert, how do we change this situation?
Because 70% of our children are in rural areas with disability. So how do we go and test them there? I'm asking you that, a counter question.
थोड़ा टेस्ट गुजरात में, थोड़ा कर्नाटक में, थोड़ा बॉम्बे में नहीं चलेगा।
टेस्ट जो रूरल एरियाज पे होते हैं वो सिर्फ डायग्नोज करते हैं लेबल करने के लिए।
लेबल नहीं, डायग्नोज मैम, डायग्नोज नो।
देखो, I agree if you are testing the child to refer the child for proper support.
Anyway,
but if you are testing the child for educational transaction, then I think it's a bad idea.
Provisions के लिए टेस्ट होना आवश्यक है, मैम. I'm not through.
100%.
What are the examples?
Provisions के लिए होना जरूरी है. Education
What are
के
the
लिए
examples of specific and practical strategies a teacher can use to support the emotional needs of studies of students in the classroom? Very specific and practical strategies a teacher can use.
You first, I'll answer then. I think the teachers with such large numbers need to build a better rapport with the students. I know teachers who have been doing it, and they could prevent a suicide by a girl just by being observant. So the awareness about the kind of problems the child may be having, if the child is withdrawn, if the child is not mixing up with other children, if the child appears to be anxious, he's attention deficit, the certain signs that, the teacher has to recognize before she refers the child to some professional. And also the teacher should have knowledge about some support service around whom one should refer to. The parents should be more involved. The community has to be sensitive. Because generally, whenever there is a mental health problem in the rural areas where 70% of our disability is, people say, pagal hai. All disabled are pagal. So even if they have proper intelligence and all that, they will say that. So that stigma. Teachers need to be aware where to put their finger and then refer that child to the thing. So specific strategies would include building up the rapport, talking to the child, talking to the parents if they find a problem, trying to get into it, finding the support services, and being sensitive to the child's needs, anxiety, all those things. Thank you. Especially for children with disability, they need to be more accepting and more warm and show empathy. I think.
Thank you. I think what is important for all you young girls and boys who are working in schools, don't say that the school is alone your karma bhumi. You have to go into the communities and create awareness of disability. Don't wait for a fund. Don't wait for a guide, and don't wait for a mentor. You have to just one day in a week get into the community and create awareness of all disabilities without being asked to go. I think you're all mental health soldiers, you're all mental health missionaries, you need to do that. Thank you. Now, ma'am, same question. What are the examples of specific and practical strategies a teacher can use to support the emotional needs of, very long sentence here. One second. Specific, specific and practical strategies for a teacher.
Okay. So,
No,
yeah.
I'm an anchor in a TV channel. आपने जो दिया वही पढ़ूंगा.
So many of the strategies are very much the same. We have to build a rapport and create a relationship with our students. And we do that from the very first moment that we meet them. We need to be, we would not speak with their parents because they're adult learners, but we would be aware of the signs of a student who may be in distress. And we would signpost, we would bring them in. We have what we call personal academic tutors, and part of that role is pastoral. So it's not just about the academics, it's about, I can see, or your other lecturers have highlighted that you're not attending or that you've become quiet, and we have those conversations. I think the team work as a team, so they would actually speak with the student, and we try to identify who within the group is the safe lecturer for that person, because they may not feel that comfortable speaking to their PAT or to their course leader, but there's someone else on the team that they would go to, and we would then signpost. But we would actually help them in that referral. We would send a message to our counseling services to say, this student has discussed this, they've given me permission to contact you, they will be joining you for a particular appointment. We have a triage program that exists within our counseling and mental health system. The other thing is we have what we call well-being days, which allows students to feel a part of this university community. So we focus on creating a sense of belonging within the cohorts that we're teaching. The courses that we run meet only one day a week on campus, so it can be really hard to create friendship groups. And so our starting point during induction is that process of creating a community of students and a community of learners, and the staff are all involved in that process. All of the staff have received training in relation to suicide and being aware of some of the signs and symptoms, but also being aware that if a student were to tell us that they have suicide intentions, that we would know that that requires certain steps within the university. So we all try to do that, and we also have some mental health first aiders on the team, so they've been trained specifically to support mental health within the student cohorts.
I think, thank you. What she said is structured activities in different ways you're doing. And what is very important is interact with teachers and don't believe one lecture can create awareness. One lecture.
Can I add one more thing? Just kind of thinking about some of the comments we've had earlier, some of the sessions we've had. So thinking about Sean's session about voice. I think someone else spoke about voice. The programs that we create at the university usually have the input from the students as well as to what would work best. The services that are university-wide have used that approach, and it's an approach that's currently being researched in the UK.
That would be of great use for us. And what is important is, one sec, so what is important is teachers generally need to be encountered frequently, and that's what is important. Yes, sir. I've heard that. That's, thank you, sir. Lastly, as we, because half an hour and I'm very meticulous on time. Yes, yes. Yes, Sujata? Yes. Okay. Okay, okay. ओए, मैं कोलैप्स हो जाएगा पूरा कॉन्फ्रेंस. RCA has released a fatwa. We saw it, we saw it. I think the first thing is forget the law and forget the arguments by the school, etc. First, heal her. She needs to be healed and she needs to understand that because of lack of awareness, because of shame and stigma, lakhs of people don't come and share. Though it is very important for our psychologists and others here to see to it that people come and share and encourage them to share. And that cannot be a point held against them because of the state of affairs as of now. That's number one. Number two, if this lady wants to convert her pain into a movement and into meaning in life, she should meet others also who are actually doing the same. But, ah, yeah, no, no, no. If somebody is suicidal, no confidentiality, break the confidentiality and tell us, which is very important. And we have really done it all the time. And unfortunately, probably she has not said, but she needs to be dealt with very, very, very compassionately. Mother, yeah. So what happens is, ma'am, we also get very traumatized when somebody dies. Now, this girl who passed away was under somebody's care. But let me make a statement today. Suicide is preventable, but all suicides are not preventable. A patient with a heart attack may not go home all the time from the ICU. They may go upstairs. So that is something we need to understand. Except if you're given care to the patient, then it means you have done psychological vigilance and psychological activity. But when you have denied the care, then it is psychological negligence. So all suicides are not preventable. Last question, and 30 minutes. Um, what are how do we look at mental health in India, Anita? And what are the three things which all of us need to do as teachers, as educators and psychologists in the country? And for you, the state of affairs of mental health across the world. And what are we looking? There are wars happening everywhere. The world is affected by chronic disaster syndrome. And India is also a place where there's rapid social change. Though I'm very optimistic of my country, they say it's a melting pot. I say it's a magic pot. So let's see what happens. So both, yeah. Mental health in India. तीन चीज क्या करना चाहिए?
I will talk about children because school children, we were talking about school children. First of all, we must be very, very sure about this thing that if the mental health issues are not detected in the childhood, the adult person will definitely have a lot of problems. So first of all is identifying the mental problems or mental illness or mental health problems in children is the first thing we should be really focused about. Even our policies should focus about, because these are the ones which grow into real schizophrenias and other kind of diseases. Second thing I feel is the teachers who
Photographer.
are so,
इधर आके सामने से भागते हुए.
the second thing I would say, you said two things, na? Three things. Second thing I would say is that in the school, the teacher needs to be also mentally healthy. I feel that we don't have any tests for the teachers.
We
Okay.
do.
So while
We
employing them,
we do
we need
PHQ
to,
9 every 3 months in our school. I come from a
yeah,
school which I
so
run, SM
your
Shetty.
school may be doing it, but in our
PHQ 39 every 3
70%
months.
will, in our schools in semi-urban village, they don't have it. So many problems of their house are brought in the classroom, and they bring it in such a way they affect the children. So I think one thing is very important, that teachers need to be aware that children can also have mental health problems, and these are just health problems, like any physical health problem. And third thing, I would say the policies should go into massive training programs for the teachers, creating awareness about the resources available, where in a village school, if the child is having problem, where they can go, what can they do, that kind of information, handouts, manuals, or some material, awareness creation, all that is very necessary. Thank you.
Thank you, ma'am. Yes, ma'am.
I have a big question. The whole world, I think the mental health issues of the whole world at the moment.
The Britons know everything about everybody.
I'm not British, thank you very much. I'm American, but I'm Irish. I prefer to be Irish, yeah. There's a lot of problems in the world. We have what I would call big man syndrome. We have a lot of new people running countries who are much more interested in themselves than they are in their societies. We have wars happening in so many different places, and we have disagreement. We have people who won't speak to one another because they have one ideology and someone has a different ideology and they can't come together. That causes a lot of stress. I know when I go back to the States, I think about who and what I'm saying because I don't want to have an argument. But then I think by not having my voice, I'm part of the problem. And so that divide continues. And that causes stress, it causes anxiety. Depression has increased in the UK, and I know the World Health Organization and some of the UN bodies have strategies around mental health, but I can't give you specifics because that's not my area of study. I can tell you from the perspective of being a head of department for the past 8 years that the number of students with mental health issues is higher than it has ever been, and it continues to rise. The support services available are very limited. The UK's child and adolescent mental health system is pretty much falling apart. So those students with disabilities, and I can talk from the perspective of being a trustee of a school for the visually impaired and the blind, the number of students with mental health issues and a lot of complex issues within that school has increased threefold over the last 2 years. They have to really look carefully about the different students they're bringing in terms of whether they have the capacity to support them. And a lot of that capacity is around mental health. So training of teachers, having support staff in the schools who can actually support students with mental health issues is something that would potentially help. However, you also have the issue of finances. So the resources within the education system, particularly in the UK, is quite difficult at the moment.
Thank you. I would just request, one sec, please sit down. I would request my boss here. Can I take 2 questions from the audience? Yes, sir. Your name, sir? I know him, I know him. I was involved in many of those helplines. Let me start by saying that when the helpline started, there were hardly any callers. So as of now, helplines which are sustained across time, there's more credibility and more calls. But true outcome studies of what they have done should be available from the helplines. But I don't see any very hardcore published material. But helpline is better than no helpline, and that I think is the philosophy. Any more questions from the audience? Yes, ma'am. Yeah, shout from there. Like the way you shout at your principal. Come, get up. Yeah. Should not be seen as a isolated issue. Yeah, it should be seen. Context.
I,
Absolutely. This is the first thing we said. It should be.
What's your name, ma'am? Swagatam, congratulations for this question. Please sit down. Thank you.
Can I just?
And I would take one. I would extend that answer after her. Please sit down. Great question, ma'am.
I think it's the title of the conference, intersectional.
Please close that door.
The intersectional experience, mental health is never on its own. If you're using the social model, then it's the everything that surrounds that individual that matters. And just dealing with the mental health issue, it's like putting a Band-Aid rather than actually resolving some of those other issues.
Thank you. And we close. And I would like to add, ma'am, all of us, you included, should be culturally competent, should move around the society, understand caste, culture, and other things. And that will bring about a lot of context. Lastly, I think both of them were wonderful speakers. And to sum up in 3 lines, what they said is persevere, be persistent, be patient. Change might not happen in your lifetime, but keep pushing the button again and again. And what ma'am said beautifully was to create systems and structures as well as programs which can be tailored towards teachers. I would close this session by sharing a prayer. You will say it after me. It's a non-religious prayer. Will you share it? Are you sure? Yeah. Every child is important. All children are equal. Every child is different. Every child can learn. No child is born a criminal. Transformation is possible in every child. Thank you, friends.
Can I add a line here? Every child can learn.